How war advances medicine faster than peace. Did you know that during World War I, surgical techniques advanced more in 4 years than they had in the previous century? From antibiotics to modern trauma care, history shows that war has an uncanny ability to drive medical innovation. But why does progress often come at such a high cost? War is one of humanity's greatest tragedies, yet it often sparks advancements that save countless lives. Throughout history, the horrors of the battlefield have forced doctors, scientists, and engineers to innovate under extreme pressure. These breakthroughs, born out of necessity, have transformed healthcare and revolutionized the way we treat disease and injury. It's a paradox. While war destroys lives, it also pushes the boundaries of human ingenuity, advancing medicine faster than peace ever could. Today, we'll explore how war has shaped modern medicine, from life-saving surgical techniques to the discovery of groundbreaking treatments. Why does war accelerate medical progress? The answer lies in urgency and necessity. During times of peace, medical research often moves at a steady incremental pace, limited by funding and resources. But in wartime, survival becomes paramount. Governments pour resources into research, and doctors are forced to develop solutions for injuries and diseases on an unprecedented scale. However, this progress comes at a steep price. The very conditions that drive innovation, mass casualties, extreme pressure, and ethical compromises, are also the reason these advancements carry such a heavy moral weight. Can we truly celebrate the progress of wartime medicine when it's built on the suffering of so many? This paradox raises important questions about how we approach healthcare development during peacetime. What lessons can we take from wartime innovation, and how can we apply them without the cost of conflict? Let's look at some of the most striking examples of medical advancements driven by war. During World War I, the development of modern surgical techniques skyrocketed. Doctors dealing with trench warfare injuries were forced to innovate quickly, leading to the widespread use of antiseptics and advancements in reconstructive surgery. Blood transfusions also became more reliable, as physicians learned how to store and transport blood, saving countless lives. World War II brought the advent of antibiotics, particularly penicillin. While Alexander Fleming discovered penicillin in 1928, it wasn't until the war that scientists perfected its mass production, spurred by the need to treat wounded soldiers on the front lines. This breakthrough revolutionized medicine, turning once deadly infections into treatable conditions and paving the way for the antibiotic era. The Vietnam War introduced modern trauma care. The sheer number of catastrophic injuries led to innovations in triage, emergency response, and the development of the air ambulance. Helicopters transformed battlefield medicine, allowing medics to evacuate wounded soldiers to surgical units in minutes rather than hours. This concept, known as the Golden Hour, has become a cornerstone of modern trauma care, saving lives in both military and civilian settings. Even psychological care saw advancements. The term shell shock, coined during World War I, evolved into our modern understanding of post-traumatic stress disorder, PTSD, thanks to research during and after conflicts like the Vietnam War. One of the most significant breakthroughs in wartime medicine was the invention of the Mobile Surgical Unit during World War II. Known as Mobile Army Surgical Hospitals, or MASH units, these facilities allowed surgeons to perform life-saving operations closer to the battlefield than ever before. The concept was revolutionary. Instead of waiting hours or days to transport patients to a hospital, medical teams could set up mobile units that were fully equipped to handle trauma cases. This innovation drastically reduced mortality rates and forever changed how emergency care is delivered. MASH units didn't just save lives during the war. They inspired the creation of modern-day trauma centers and emergency medical systems. The ability to treat patients quickly and effectively in high-pressure situations is a legacy that extends far beyond the battlefield, benefiting millions of people worldwide. War is an undeniable tragedy, but its role in advancing medicine cannot be ignored. From the surgical breakthroughs of World War I to the development of antibiotics in World War II and the creation of modern trauma care during the Vietnam War, these innovations have saved countless lives. The paradox is haunting. War accelerates progress at a pace peacetime rarely matches, but at an unimaginable cost. The challenge for us today is to take the lessons learned during these times of crisis and apply them in ways that prioritize innovation without the backdrop of violence. Medicine has come a long way, but the story of its advancement is deeply intertwined with humanity's darkest moments. By reflecting on this history, we honor those who suffered and ensure their sacrifices were not in vain. What do you think about the connection between war and medical advancements? Should we do more to accelerate healthcare innovation during peacetime? Share your thoughts in the comments below and check out our next video. Don't forget to like and subscribe for more stories from the shadows of history. Thank you for watching.